All right, guys, when it comes to this next round of stimulus negotiations and what's going on in politics today, it looks like Senate Democrats are trying to send out to seniors a $1,000 cash voucher if the expansion of Medicare goes through for 2022. We're going to talk about that, as well as when it came to individuals receiving their stimulus payments. The IRS requested for some of you, we're going to always be here for you and your loved ones. Let's get started. Yes, Senate Democrats, which include Bernie Sanders, Chuck Schumer, and also Elizabeth Warren and others, have been trying to expand Medicare for 2022. And many of the ways that they're trying to expand it is trying to make sure that they have free hearing, free vision, and free dental for individuals, as well as lowering the requirement age for individuals to receive these Medicare benefits to the age of 60 years old. But now they also want to get a $1,000 cash voucher out to you that will help you pay for some of your medical bills. Now, I know many of you are thinking that you just want a cash voucher to pay on bills and other things that you need the money for. However, they feel like if you have a $1,000 cash voucher to take care of your medical, that will save you money to be able to pay for other things. At least $1,000 that will be able to stay in your pockets.
President Biden's budget proposes an historic investment in the American people. When it comes to health care, the president has called on Congress to do more, especially for Medicare. Now, Medicare is very popular, but it is not perfect, especially when it comes to covering the services that older Americans need. For example, 50% of people aged 75 or older have a disabling hearing loss, but Medicare doesn't offer a comprehensive hearing benefit. It also doesn't cover full dental or vision services, even though 70% of seniors have no dental insurance, and older Americans are at increased risk for severe eye problems. So that's why the president, as part of his budget, called on Congress to, quote, improve access to dental, vision, and hearing coverage in Medicare. So, Secretary Becerra, let me ask you, how would expanding Medicare coverage to include vision, dental, and hearing services improve the health and well-being of Medicare beneficiaries, especially low-income beneficiaries and seniors in medically underserved groups?
Well, Senator, I think as we've discussed in the past, and I think the president's made very clear, we have ways that we can expand these services, and in fact, we must, because we know it's to our own benefit to provide these preventative services as early as possible to our seniors. What I can tell you is that there are ways to pay for these additional services. We've discussed some of those as well in the past. If you were to save money on prescription medication by negotiating prices or providing that the industry must provide rebates when it increases prices too quickly, you start to develop the resources you need to pay for things like providing access to oral dental health services, vision services, hearing services. So we're looking forward to working with you to make sure that we continue to make Medicare even better. And where we go, I know that really will depend on Congress, but we're ready. We want to be a good partner.
Good. I'm glad to hear that. I think that's terrific. Expanding Medicare to cover health conditions that affect seniors is an obvious move, and it is the right thing to do, which is why the president has called on Congress to do it. But it's not just people 65 and over who need better access to care. There are plenty of people just shy of Medicare age who need better hearing, dental, and vision coverage, along with all the other benefits that Medicare has to offer. President Biden's budget also calls on Congress to give people aged 60 and up the option to enroll in Medicare, a policy that some analysts predict would give 23 million people, including nearly 2 million previously uninsured people, access to the program. So, Mr. Secretary, why is it so important that Congress follows through on this proposal?
Senator, for all the reasons we now know as a result of that, we have too many Americans who don't have any coverage and too many Americans who don't have enough coverage. And the worst thing we can do is allow our family members who are reaching the age of qualifying for Medicare but aren't quite there, who typically are going to be more at risk of suffering from a health condition, the lack of access to the kind of care that they will need. The president, as you mentioned, has been supportive of having the public option of having those 60 and older apply for Medicare. He has mentioned on many occasions that he's open to considering so many different ideas, but what he wants is for us to get something done.
Good. I like that. You know, I strongly agree with President Biden. Congress should expand Medicare to include vision, hearing, and dental coverage, and it should lower the age of Medicare. In fact, I think we should go lower than the president proposed to age 55.
Now, as you've just heard from these two senators, one of them including Elizabeth Warren, they want to make sure with this $3.5 trillion infrastructure stimulus plan that you will be able to receive benefits, which include the expansion of Medicare. And as I mentioned before, with that expansion comes along with a $1,000 cash voucher. So we're going to see how this goes, because we know that there's Joe Manchin still looming around trying to kick up dust, causing you to not receive the expansion that you need when it comes to your Medicare. Now, when it comes to Medicare, a lot of people don't realize there's a lot that Medicare pays for, yet there are still some things that Medicare doesn't pay for.
Did you know that 9 in 10 seniors are happy with their Medicare coverage? That's the really good news. The bad news is that Medicare doesn't cover everything, and in fact, some benefits you've grown accustomed to with private employer health plans aren't included in Medicare Parts A and B. Hi, I'm Danielle Roberts, co-founder here at Boomer Benefits, and here are 6 things Medicare won't pay for. Medicare only covers up to 100 days in a skilled nursing facility per benefit period. In order to qualify for this coverage, your stay must be following an inpatient hospital stay of 3 days or longer, and you must need a higher level of care than just help with activities of daily living. If you only need custodial care like assistance with eating or bathing or toileting, Medicare won't cover your stay. It just doesn't pay for this kind of care alone. Furthermore, if your skilled nursing facility stay is covered, there's a hefty $176 per day copayment in 2020 for days 21 through 100. Medigap doesn't cover your out-of-pocket costs for these prescriptions, so most of these medications are going to fall under Medicare Part D. However, the built-in plan may or may not include your medications in the formulary, so be sure to check this before enrolling in any Medicare Advantage plan. If you travel outside the country, you won't have health coverage with original Medicare, even for emergency care. As you age, your risk increases for many dental conditions. Seniors have a higher incidence of dry mouth, gum, root decay, and oral infections. It's important to continue your routine dental care in your retirement. Unfortunately, routine dental visits aren't covered under Medicare A or B, and neither are treatments for cavities or root canals or other serious dental conditions. Medicare only covers medically necessary dental services that you need to treat a health condition. For example, if you have oral cancer and you need dental surgery as part of your treatment, Medicare may cover that dental surgery under your medical benefits. It sometimes also pays for routine dental exams if you need an exam for a clearance prior to a heart surgery. If you have a Medigap plan, it also won't pay for out-of-pocket dental costs that are not covered by Medicare Parts A or B. Fortunately, there are many companion dental plans on the market for seniors today, and these range from discount plans for common services to more traditional full coverage dental plans. If you plan to continue your routine dental exams and cleanings, and you should, it makes sense to look into a separate dental plan. Alternatively, some Medicare Advantage plans include benefits for routine dental care. If the plan includes dental, it often covers routine exams and cleanings at 100% with or without a small copay. If dental coverage isn't included in your Advantage plan, you may be able to add it to your plan for an additional monthly premium. By age 65, 90% of seniors have a cataract and about half lose some vision because of it. Most older adults will need regular vision care to maintain and correct their vision. Unfortunately, Medicare typically doesn't cover eye exams, glasses, or contact lenses. But if you're diagnosed with cataracts, Medicare will pay for the surgery and one pair of corrective lenses afterward. Any ongoing routine care after that point is not covered. Routine vision care is often available with Medicare Advantage plans, either as an included benefit or as a supplemental coverage that you can add for extra money. You may also be able to enroll in a vision discount plan via your Advantage company, depending on where you live. 1/3 of seniors between the ages of 65 and 74 have hearing loss, and over half of those over 75 are hard of hearing. Few insurance plans cover hearing aids due to the expense because these are around $2,700 out of pocket for a pair of hearing aids. Medicare doesn't cover any routine hearing care, so if you have hearing difficulties, you pay 100% of the cost of your exam, hearing, fitting, and the hearing aids themselves. Medigap plans can't contribute. It's really important to comparison shop your options before you choose your Medicare path.
So as I've been saying, we're going to continue to follow what's going on with this infrastructure stimulus bill and how it's going to benefit you, especially this month and next month when they start doing all the voting and start putting in all the proposals inside of the bill. Now, when it comes to stimulus, many of us, 164 million of us, have received our $1,400 stimulus checks. However, to many of you, the IRS is saying they want the money back.
That was Natalie Bonelli's reaction to getting this letter from the IRS demanding she pay back the $600 stimulus payment she claimed on her 2020 tax return, plus $3.12 in interest.
We found a miscalculation on your 2020 form. It has a little dot that says recovery rebate. We changed your return to correct this error. As a result, you owe $603.12.
Let's back up. When it began, Natalie was living in Brooklyn, and that's where she received a paper check for the first stimulus payment back in the spring of 2020. But then she moved home to Massachusetts and says that second stimulus check last December for $600 apparently still went somewhere in Brooklyn, but not to her.
I know for sure it got sent to Brooklyn because I went on mypayment.com and checked. So it did get mailed to the old address. I just never received it.
So she did what the IRS said to do, claim the missing payment, which she says she qualified for and is rightly hers, on her tax return. She thought she was done with it until this letter came in the mail.
And now I have to give back money that I never got. So it's a little bit frustrating.
The IRS says taxpayers in the same boat can simply call and request a payment trace, except it's not so simple.
Endless calls to the IRS.
Natalie says she spent hours calling at least 3 different IRS phone numbers, but never got through to someone with the power to actually trace that check.
I never got an answer. I could never get to someone who could actually help me.
Her notice, dated July 26th, arrived at the start of August, and it said she only had until August 16th to pay up. Not a lot of time to figure out what happened given the ongoing IRS backlog. Since shutting down for the last year, the IRS has faced severe delays, and it's become impossible to get through on the phone. An IRS spokesperson would not comment on Natalie's circumstances, but told us taxpayers can also fill out this form, 3911, to request a payment trace. Not being able to get answers is still frustrating for Natalie. She says it should be easy for the agency to find out whether someone cashed her check illegally.
But I can't be the only person, Ben. That's why I wrote to you. I'm like, I can't be the only person on the planet who didn't get one of the payments and can't find out why. You know, I'd love to have the money that's owed me.
So if you receive a letter, first thing you want to do is look for a phone number. Once you see that phone number, give it a call, because you want to verify that if this information is legitimate, if you need to send the money back. If you do, you can always make payment arrangements with the IRS. But for most cases, most of us receive the stimulus payments and we don't have to pay it back. I just want to make sure that everyone gets the opportunity to be aware of that could happen. I'm going into the comments section immediately, and I'll see you guys there. And if I don't get a chance to speak to you and you don't get a chance to speak to me, we're not going to fret about it, because I'll be speaking to you again. My end.